Dr. Budoff, how do clavicle fractures usually occur?
Clavicle fractures, collarbone fractures are common fractures. They usually occur from a fall. You can fall on the outstretched arm like a lot of quarterbacks do in football and they get clavicle fractures. Usually it's from some type of a bicycle, either just a regular bicycle or a mountain bike or a motorcycle.
How are clavicle fractures diagnosed?
Pretty straightforward. They're painful. You can often feel the fragments moving against each other. There's swelling there. And you need good x-rays. For whatever reason, a lot of times x-rays taken at emergency centers won't show them. So you really want to follow up quickly with a shoulder surgeon or an upper extremity surgeon, some type of an orthopedic surgeon specialist, and get good x-rays which will diagnose it.
How are clavicle fractures treated?
If the clavicle fracture hasn't moved, or it's minimally displaced, meaning that if this is the clavicle and it's just translated a little bit, that's okay. If it's just angulated, meaning not straight, just angulated a little bit, that's okay. Those can be treated in a sling for 6 weeks. Some people that do a lot of typing, it's acceptable to use a figure 8 strap. It just goes around the clavicles and holds them back in better position. Most people prefer a sling. Now, what you don't want is shortening. So if it's translated and shortens, that pulls the whole shoulder in. And then if you leave it there, everything gets tight in the front, stretched out in the back, and all the muscles get misaligned or aligned poorly, and you lose strength, you lose function of the shoulder, and that's pretty much permanent. And when the shoulder's weak and not doing well, then it affects the entire arm. So you don't want shortening. If it's 100% displaced and things aren't touching, that's not good. If it's in many pieces, that's not good. What you want then is you want to get it fixed in better position. And if you get it fixed within a few weeks, that they do just great. What we do is an outpatient surgery. It takes about an hour and a half or your day, but we just make an incision and we put a plate on it. We have specially designed plates that are contoured better for the clavicle because it's a little bit of a S-shaped bone, so it's not a straight bone, so you need these special plates and they lock in, they're very strong, and these do very, very well.
What happens if you don't treat clavicle fractures?
Well, if you have just a crack or it's not translated and you don't wear your sling and you say, to heck with it, I'm not going to stop doing what I'm doing, and you just go back to your regular activities, it can angulate more, it can displace, it can shorten, and then you wind up buying yourself a surgery that you would have avoided had you just sort of behaved yourself for about 6 weeks. If it's shortened or translated or highly angulated, and you let that go and you don't fix it, you can have permanent problems with the shoulder. Again, all the muscles become misaligned. You can get this permanent pain in your shoulder blade muscles because they're all stretched out. Things shorten down in the front. You get a lot of scarring there and things get too tight, and it just doesn't work as well. Now, if you come back later down the line and it's not working for you, say, well, just put some bone graft in there and lengthen it. That will help it, but it'll never make it as good as it would have been had you just gotten it fixed within the first few weeks in the first place. So if it needs to be fixed, pretty much want to get it fixed. In Europe, they have these major trauma centers where they do very, very high volumes of fractures, and they're fixing more and more clavicle fractures. They're finding that they do better when you just fix them all acutely. In America, we're more conservative than that, and there's a lot more treated without surgery. But basically, if it's shortened or displaced and then it's not going to heal, you're going to have problems if you don't get it fixed.
Thank you for your time today, Dr. Budoff.
Thank you.